cannabis has been really beneficial in like many other ways, just from the sort of flare ups and pain and just kind of using it as and when I need to. But I actually think a lot of my benefit comes from mental health purposes and that sort of constant anxiety that I have. And I've been doing a lot of sort of soul searching, I guess, in the last few years. And actually, I have noticed that it does definitely have a role to play in sort of my kind of health and well-being, but it's just not, I guess, in the way that you might expect for a Crohn's patient.
Hi, everyone, and welcome back to Harmonia Podcast. We are joined here today by the beautiful Sarah. Hi, Sarah.
Hey, it's so lovely to be here. Thank you.
No, thank you for coming on. Sarah, I was going to do an introduction, but you know what? You've done so much in terms of your work in the medical cannabis community. So I'm actually going to hand over to you to do a more formal introduction.
Thank you. That's very, very generous of you to say. Yeah, so I'm a journalist. I've been a journalist for about 10 years, and I've been sort of the last 4 or 5 of those have been in sort of health journalism, kind of specialist health journalism. I started off on sort of local newspapers and then kind of segued into that. And through that, I sort of by chance ended up the publisher that I was working for happened to have a connection to Professor Mike Barnes, and they were launching a cannabis magazine, and that ended up being what is now Cannabis Health. So I kind of just totally fell into it by accident. I didn't really know anything about cannabis, like in a medicinal sense, as the story goes. And then I started writing about it and kind of hearing all these stories, and I was like, oh wow, like this is really important. And it just kind of like my eyes were like opened, and then after that, I've got a chronic condition as well, so it just kind of all fell into place for me. And it's something that I'd been wanting to do for a long time, was write about patient stories and patient experiences, um, and the sort of challenges that we have with the conventional medical system at the moment. So yeah, it all kind of just fell very nicely into place. So I worked as the editor for Cannabis Health for 3 years, I think, and through that I had amazing opportunities. Like, I spoke at Cannabis Europa and Product Earth and various industry events. I've met a lot of very, very amazing, fascinating people in this field. And then I went freelance in September, and since then I still write for Cannabis Health, but I also write for Forbes about cannabis in Europe and various other places, and also, more broadly write do kind of health journalism. So it's been quite nice actually to broaden out a little bit and still have my like feet in one foot in the cannabis industry, but like not be totally consumed by it every day, which is quite nice. So yeah, that's basically me at the moment.
No, that sounds incredible. And I know as somebody who has read a lot of your journals, it's amazing the amount of awareness that you actually put out there. And I know that you do dedicate the majority of your writing towards medical cannabis, towards cannabis health. And you mentioned, I suppose, having your own experience with medical cannabis. Is that something you want to explore a little bit further?
Yeah, I mean, I can do. It's quite an it's not. I mean, it's a bit of an unusual sort of one in the sense is that I'm not actually a medical cannabis patient legally in the UK, um, which I often. I mean, I have many different feelings about, but it's not something that I'd ever used medicinally in the past. I've used it just in the sort of recreational sense when I was younger, and then I've got Crohn's disease, which is obviously a condition which a lot of people do find a lot of benefit from cannabis for. Um, so kind of, a while after I started work, it was actually quite a while into Cannabis Health where before I started sort of consuming cannabis medicinally again. And it's still, I wouldn't say I use it on a daily basis. I wouldn't describe it as like my day-to-day medication. I'm actually on some 8 weekly infusion of sort of a biological drug, which touch wood keeps my Crohn's like relatively well managed. Um, yeah, exactly. So I'm quite reluctant to sort of rock the boat with that, but cannabis has been really beneficial in like many other ways, just from the sort of flare ups and pain and just kind of using it as and when I need to. But I actually think a lot of my benefit comes from mental health purposes and that sort of constant anxiety that I have. And I've been doing a lot of sort of soul searching, I guess, in the last few years. And actually, I have noticed that it does definitely have a role to play in sort of my kind of health and well-being, but it's just not, I guess, in the way that you might expect for a Crohn's patient. Although maybe that's just who knows, who could say that.
No, and do you know what? I'm actually glad that you said this. I mean, wow, you've said a lot of stuff that I want to unpick here. You know me, ADHD, my brain is literally going like, oh. So let me write this down very quickly.
Okay. I'm a little bit scared now of what we're gonna unpick here.
No, don't be scared because I'm actually, if my brain is going haywire, it's because I got excited and now I don't know what to say first. No, but one of the things that I loved about what you mentioned is people generally tend to think that when it comes to medical cannabis, you have to take it regularly and stuff like that. I've been very open on this podcast and I've explained that, yes, I still do have my NHS treatment. And I've explained as well on several occasions that no one is saying get off the NHS medication. Do you know what? If it's working for you, brilliant, you stay on it. And I'm like you, if I find something that's working, I am not rocking the boat. Do you know what rocking the boat means for us? Like, no, thank you. Right? So, no. And from what I understand, it sounds like you use the medication when you're having like a really bad flare up. So it's more PRN basis. Again, what's the difference between you going and getting cocodamol to use for a flare up and you using medical cannabis? You've just chosen a different medication instead. So there's absolutely nothing wrong with that. And you'd be surprised that there are a lot of patients that do use it like that too. I know everyone's used to hearing, like, cases like mine where everything failed and I had to use like only medical cannabis and I used the other stuff PRN. But no, every person's case is different. So it's really, really important for you to share that with people as well, because there might be people in your shoes who are thinking, well, I don't really need it that much, but I do sometimes have really bad flares that nothing helps with. You can still use it as well. This medication is accessible to you too. And then the other thing that you mentioned, which I think, again, especially with people with chronic pain, not chronic pain, sorry, a chronic illness in terms of your physical health, we never really talk about is the impact that it has on your mental health. And it has a huge impact on your mental health. Sometimes it actually impacts your mental health more than it actually impacts your body. So it's really good that you say it.
Yeah, it's something that's really like a big for me. I think because I sort of had mental health I had mental health diagnoses, I guess, before I even had a physical diagnosis. So for me, that was always like the main thing that I was dealing with. And then suddenly it just adds this like whole different element to it. So I just sort of I'm very passionate about talking about they're not separate things. Like, it's one whole thing. And I think that's just I think we are slowly getting more aware of that in the medical system and stuff. And I've got an amazing consultant who thankfully is really we just have chats about everything and my whole life and everything in it. So she would really just take that holistic approach. But yeah, I think hopefully we're getting better, but there's still very much this like I think we just struggle to see them as one thing.
No, I fully agree with you. I think nowadays, a holistic care is being, I suppose, advocated for more within the NHS or everywhere. To be fair, I'm always screaming and shouting about it too, because it is so important. People just I say people, but I should probably say healthcare professionals because it's sad because they also like experience feel this way. Sorry, sometimes is they overlook the impact that your health has on the rest of your life, and as a result, how that then impacts your well-being. I mean, when you aren't well, you're not really able to socialize, forget exercising. There isn't, you're not sleeping either, so that's going to double down on the insanity. There's just so many areas of your life that are impacted as a result of your physical health, and often even when your physical health is, let's say, in remission for a while, yeah, and you're feeling a lot better, you're still in a situation where, because you haven't gone out for months and because you haven't done exercise for months, it takes you so much longer to pick yourself back up, and that is emotionally draining in itself. Yeah.
And then there's this uncertainty as well that you sort of live with of you never know whether, you know, I've like been having a really good few weeks, touch wood, but I still don't know whether like next week, like I'm about to go away for a few days and I'm like, oh, usually I get really ill when that happens. So I'm just kind of waiting for it to happen. And then yeah, you just kind of live with that sort of underlying anxiety all the time, I guess.
Yeah, all the time, all the time. Even when you're trying to be happy, and like, you know what? That's me just being a bit harsh. Even when you are happy, there is still underlying anxiety, because you can still be happy and be anxious at the same time. Like, I think people forget that part. But there is still the underlying, like yourself. Every time I travel, it's like, oh, okay. Of course, now all my symptoms want to manifest, like, and just, yeah, just be a nuisance. Like, so it's, it's nice it's nice that we're reflecting on this, because I really want people who, a lot of people out there that experience exactly the same thing. Um, so in terms of medical cannabis naive patients, what sort of advice would you give them if they're considering a prescription but are very reluctant or on the fence?
I think the first thing I guess is just I would say to try and be open-minded, because I know it's kind of like a whole it's a whole thing, especially if you're not kind of familiar with it already. And then I guess the first place that I'd probably start is by reading actually about the history of prohibition and drug prohibition, because I think that kind of unlocks everything. Like for me, when I sort of learned about reefer madness and the history of the US war on drugs and things like that, it was suddenly like, oh, okay, so like this is all. Am I allowed to swear? I don't know if I'm allowed to swear, but like, like this is all bullshit. So that was kind of the key for me. And then it starts like, well, actually, like if you've been saying all these negative things about it and they're maybe not true, then it just kind of like inches the door open a little bit more and allows it to be a bit more accessible, I think. And then I'd just be very open minded about it. I would probably read a lot of stories. There's a lot of patients that have shared their stories like really openly now, and it takes a lot of courage to do that. And I think they are really powerful in sort of inspiring other people. And then I would say, you know, get clinical guidance, go to a clinic and work sort of with a doctor. I think that's the benefit of having the legal medical cannabis sector, is that you can work with a doctor and you can, you know, you've got that peace of mind that they kind of, you know, and I think as important as well as to say that like it's not, might not be like a magic treatment for you, and just to be open minded about that as well, is because it doesn't work for everyone in the same way. Um, but I just think it's worth a try. At the end of the day, you know, it might not, but you've got that sort of peace of mind. Work with a doctor, and obviously there is other things to consider like cost and things like that. So it's not maybe not going to be right for everybody, but if you are in a position where you can try it, I think it's worth a try.
Thank you. And you know what? I loved when you said look into the history of prohibition. Um, because I've never even thought about that. And it's like, actually, do you know what? No, it's a really good point. It's because when you think about it, you're like, actually, if people were to start there, they would, first of all, it would help them break the stigma, their own sort of like stigma around medical cannabis, because then they'll start understanding, actually, there is so much more to this. Than it just being a medication or just people using it to get high, because that is generally, yeah, that's generally the issues with people. Sorry, my brain fog is just not having it today. It's so hard to or speak. Ugh. But anyways, yeah, no, that was a really, really good point. Actually, I love that. And yeah, like you said, all medications work differently for people. If you were to go to your GP, you would trial a variety of different medications. The same applies here, because at the end of the day, it is a medication. What sort of feedback would you give to the medical cannabis industry then?
That's a good question. I think it's kind of a lot of the stuff that we've already, you know, that's already been said like a million times before. But and I know we spoke about this at the patient conference back in November as well. It's that need for sort of consistent standards throughout the industry. standardized treatment plans. It just needs to take itself a bit more seriously, in terms of, transparency, certificates of analysis, these things that are going to kind of help it be recognized as a legitimate medication, which we know that it is, but it at the moment it just acts very differently to any other sort of pharmaceutical or, um, like other treatments. So I think that's a sort of key thing, and I'd like to see more products sort of available in the UK. I know this is kind of obviously it's going to take time and stuff, but I still think that wildflower is great for some people. It's not going to be for everybody, and it does put a lot of people off. Like my mum, for example, has got trigeminal neuralgia, and she's been on all of these like horrendous painkillers that she has to take every day. But she's so reluctant to go down the cannabis route, and she's never going to vape it. Like she's just never going to do that. She's never going to do that. Yeah, so it's. I think I'd like to see kind of more products that are a bit more in line with like mainstream conventional medicines. And then just checking. Oh, and then the other thing I was going to say was about the sort of data collection that we've got, and this sort of, I think we're missing a lot of like T21, and I know the medical kind of patient registry. They are collecting great data and providing great insights in terms of the positive effects that we're seeing. But I don't know. I think we're missing a lot of data on the patients that have maybe dropped out or haven't. It hasn't worked, or like, you know potential adverse effects that people have experienced. I think it's a real shame that we've got an NHS patient registry and it's not actually collecting any data. Well, I don't know. The last time I checked, it wasn't. So it's like we could have this wealth of information by now. We're sort of over 5 years in. But I still feel like we're quite limited in terms of what we've collected.
Okay, as usual, my brain's going, ooh. Uh, so I suppose the first place, yes, I fully agree with you. Standardization, that's just something that is really, really, really needed, especially if we plan on having GPs pick up prescriptions. If you want to incorporate this into the NHS, there needs to be some guidelines at least, some standardized guidelines for everyone. It makes people feel more comfortable with prescribing at the end, it's a Schedule 2 medication. It's unlicensed, yeah. So it makes people feel more comfortable with prescribing an unlicensed medication, and so many other reasons as well. It's much better for patients as well, because this way we can start looking at, because one of the things I've always found very um I suppose just, I don't know, curious, yeah. um if I were to go to, let's say, oh, do you know what? Anywhere, yeah, anywhere. If I were to go to a GP, a hospital, substance misuse services, or whatever, there is a point in which, when you reach that point with your medications, they will consider that as ineffective treatment, and they will then trial you on a different type of medication, because clearly this medication isn't working for you. So without standardization here, we don't really have that. And I understand, again, like all medication, everything works differently and stuff like that. And for everyone, it's going to work differently. But we have to, at some point, have some kind of a cutoff. Because the way I look at it, I see prescriptions sometimes that are 120 grams. And I'm like, you must be vaping every 15 minutes to get through that. No, no, but think about it though. Like, think about the logistics of that. That, well, maybe I'm being I'm probably am definitely being, but you know what I mean? Yeah, on the product availability. Oh my God, I don't stop screaming and shouting about supply chain. Every single prescription there is an issue. Every single prescription takes me 3 weeks to get, and I'm somebody who actually depends on their medication. So at the moment, I do not have my medication for about no, 2 weeks now, because yet again, they've messed up my prescription. The last prescription, 6 weeks, they actually gave me in bits and bits, but the average waiting time for me is 3 weeks. Why? And I put my prescription through early, and it's still like, you still.
Yeah, it's crazy that like I think because I remember writing about this back in sort of like 2020, 2021, and I can't believe that this is still an issue that patients are experiencing like every time they get their prescription. It seems it's madness.
Every single time. Don't get me wrong. There's the odd time here and there, not for me, but there's the odd time here and there where I hear patients and they're like, "Oh yeah, I don't really have much supply chain issues," and I'm like, "What? Where do you live? Maybe I need to move and my medication will get to me on time." Like what? But yeah, no. Unfortunately, it is still a very, very, very big problem. That really, really just needs to be resolved. And also, I think you are very correct. Like I don't particularly like vaping. Oils don't really agree with me, but I've been moving around because now that my health has gotten a bit better, I can now start reducing on my flour, which made me realize actually I could start coming off flour. I'll still need it for bad days, and I'm using the cartridges and stuff, and I'm finding that so much more helpful. And I know someone like my mom, again, like your mom as well, like flour, give my mom flour. She will just laugh at you, like, but if you like, she would consider an oil because she does take cod liver oil. So if you mix it in with that, she could potentially use that. But my mom is more comfortable with pills. Like they're of a different generation. If they start introducing the pills here, from what I've been told, I've heard that they do have them in other countries. And I personally would like the pill as well. It's just so much easier for me as well. I don't have to like clean the vaporizers and all that kind of stuff and grind when I'm in pain. Like, that's an issue I have with the medication. It used to come grinded before, and then after the pandemic, they stopped grinding it, and it's like, I'm in pain. Now I have to sit here and go, like, do you have any idea how painful that is? Just now when I'm not in that much pain doing it, let alone when I'm dying. Um, and then you mentioned T21, yeah? Do you know what? You mentioned something that's very interesting. Yeah, we're not capturing that data because that would be amazing to know why we are losing patients. I know that, I think on one of our episodes, somebody mentioned Cannabis Health. Uh, had gotten a bit of data for some patients that left, and a lot of the patients left due to supply chain issues. Um, but it's correct, we're not getting that data. We really, really should be working hard to get that because we want to encourage those patients to come back. At the end of the day, cannabis is a Class B drug. That's, if you're lucky, you get a slap on the wrist or a fine, but if you're unlucky, that's a 5 to 7 year prison sentence. And let's not even talk about what is mixed inside of it when you are getting it illicitly. So we want to encourage these people to actually come back onto a prescription. So yeah, it's important that we get that information. That's really, really so.
Yeah. And just to be clear, like no, I love what T21 is doing. It's amazing and it's like so important that they're collecting that. I just think
Yeah, 100%.
like you sort of say, I think yeah, I did a piece quite a while ago now and did sort of interview people about what their issues were with the legal or why they were choosing to access it illegally. And yeah, the supply chain thing was a key issue. And it's just like you say, like how can we get that consistency of Joseph every time a patient's getting a different product or they're getting a different amount and they're not, it just I think that is a big issue for a lot of reasons. And like we say with this and with the patient numbers as well, I've just always felt like this. We sort of have these very extravagant estimates of like how high the patient numbers are, and oh, they'll be up to like 40,000 by now, and it's like, but we were just tracking those that have come on. We're not tracking those that have dropped out, and there might be other like there might be for health reasons that they've dropped out, and that's important that we are aware of that as well, so we can have this like balanced and nuanced conversation about it.
That's amazing. And yes, that is very correct because that means, yet again, the figures aren't actually accurate. I think we just really need a standardized process of how we are capturing this information. Like one of the things that I love about substance misuse services is they have this system called an NDTMS. Don't ask me what all of that national data something something. I only know abbreviations. I'm really bad. I never remember the actual thing. But the key element of this is every single substance misuse services inputs their data on this. So they input data on patients that are coming in, patients that are leaving, effective treatment that has worked for different patients. And then what happens is all this information is collated. They look at all of the things that we're doing right, formulate a treatment model out of that, and then implement, and then basically just try and what's the word I'm looking for? Whatever, roll it out with all of the services, substance misuse services. So A, it offers a standardized approach. B, we're capturing all of this information around patients that have left, of reasons why they are leaving, so that we can adapt accordingly. And oh God, my brain is drawing a blank again. But
No, yeah, that sounds like a really valuable tool. And as you were speaking, it was like that's what we should have in the cannabis industry. But yeah, because everyone's so sort of secretive with their clinic numbers, and obviously it's a private market, so it's going to have that issue. But yeah, I think that would be so valuable to have that sort of central database.
yeah, no, I fully agree, and I understand that it's a private market, but
Yeah, yeah, absolutely. And I agree. I don't think, it is a good enough excuse. I'm just anticipating what they would say. But yeah, I think you're right. It's patients' lives at the end of the day. And if we do want to move this forward, we need to be transparent with this information, and we need to be able to prove that this is working for people as much as, for the potential harms.
no, definitely. And just so that we sort of like round it off and everything, um, I know that you are very, very familiar with the industry, so much more than I ever will be. I just, no, 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 no. Everyone knows me. I just know the clinic side of stuff and bits here and there and whatever. I'm learning every day as I go along. But you definitely have a lot more insight. What would your sort of like expectations or hopes be for the future of medical cannabis? Like, and I'm not even going to say future. Let's just say over the next 5 years. Where would you like to see cannabis in the next 5 years?
It's such a difficult question. I actually feel like I don't know as much. I mean, because I've been sort of freelancing and working on other things, I feel a bit sort of like out of the loop of the industry at the moment. And like, I'm sure I'm still, I'm sure that's not the case. But yeah, I think just like we spoke about, I'd like to see, I think having that sort of centralized database that you've spoken about is something that could be implemented, I imagine, relatively easily, and could be like really important to move things forward. I don't think we're going to see NHS access anytime in that time frame, unfortunately. Certainly not in the formulations that are available now. But I'd like to see some more research. I think we've got some good sort of trials that are at least kind of getting started up in the UK. We've got one on endometriosis, which is going to be taking place at the University of Edinburgh, and we've got a trial on chronic pain. So there's things that are happening, and slow progress is being made. So I'd like to see a more kind of hopefully some progress with them, and hopefully some progress in terms of the wider public perception around medical cannabis. I think that is a slow process, but I think that we've still got such a big issue of patients being driving is something that I just get contacted all the time about patients that have been stopped and are going through court cases. And we had there was a really quite a positive story recently of one guy who was stopped for the second time, and he actually won his court case. Well, yeah, he was sorry, he was found not guilty on the basis that he had a prescription. So they deemed it was reasonable for him to refuse to take a roadside swab test. Obviously, that's a positive story. It doesn't unfortunately set a precedent or anything like that because each case is kind of on its own individual merits, which is important to say that. That's not to say that that would be the case for everybody, but I think that's a good sort of a tiny, tiny step in the right direction. And hopefully, like, we will get to a point where that is kind of why I think we just need a complete, there's loads of issues with drug testing on the roads at the moment. It's a whole different topic of conversation. But hopefully we'll get a bit more awareness, we'll get a bit more um, education among the police and other authorities to sort of stop this kind of discriminatory things that are going on with patients at the moment. That should be doable within the next 5 years, and I really hope that it is. Yeah, and then just kind of, I'd like on the industry side, just like some more products available. Supply chain issues obviously need to be sorted out, and I don't know, I'm not an expert in that side of things. I don't know how that happens, but that should not be still an issue kind of 10 years in. If it is, there's something seriously wrong.
No, no, no. First, those are all amazing points and absolutely brilliant points to end on as well. Sarah, thank you so much for joining us here today. It was really lovely to have you on here. For anybody that is interested in any of the work that Sarah is doing, all of her links will be in the description section of this video. Thank you everyone for joining us here today. We look forward to seeing everyone next week, where we will be exploring patient experiences. Sarah, thanks again for coming.
Thank you so much for having me. It's been so nice.